Hi guys, welcome to another episode of Breaking Barriers, the Mental Health Podcast. I'm Camila.
And I'm Lizzy, and I am beyond excited to have our very special guest here today. Her name is Silvia Cuba. She is a psychiatric nurse, director of clinical operations at Diverse Clinical Research, and she's here with us. And we're so happy because she's also our very good friend for many years.
Thank you so much. I am beyond honored to be here with both of you. So proud of everything. I mean, I came here and this is amazing. The whole team, you girls, very, very, very proud of you.
Thank you.
It's an honor.
So we used to work with Silvia at our job with the senior community, and she was truly part of an inspiration as to why I became a psychiatric mental health nurse practitioner. She's also my preceptor. She helped me through my process, and I cannot wait to see how I can also make a difference to someone's life the same way that she did with me and every single patient that she's had taken care of. So thank you.
Of course. And we were talking about it a little bit earlier too. I mean, it's an honor to me to be able to help others, for you to grow as a professional and continue your career and all your ambitions and your goals. And we have to just push each other.
Yes.
and kind of not be there for each other whenever you need it. And that's something that I go by that. Help everyone out, and it will come back to you, like Lizzy said, so much more.
Silvia, let me ask you, because I kind of want to start with your journey coming here to the U.S. Let's talk about that.
Yeah, so I came here from Cuba when I was 9 years old with my parents. I do have a younger sister, but she came, or she was born a couple of years after we were here. We're 11 years apart.
Wow.
So
like my daughters.
Yes, they're almost the same. The same. So it's it was very difficult because even though I came when I was a very young girl. Going into high school and college, the whole application process, I didn't really know, or I didn't have anyone to guide me through it.
Right.
So I think you went through it as well, and it's very challenging coming into a country that you don't know anything about, and
the language, the process.
It's a whole process. And then at the same time, you have your parents' expectations, and you don't want to let them down because they came here for you to change. They changed their entire life, to give you something different, to give you a better life. So obviously, you want to make them proud, and that's how I felt.
Absolutely.
Apart from that, I had a responsibility to make to kind of do something with myself and make them proud.
And you did.
And I'm sure they are very proud.
They're very proud, yes. And my sister too, she's such a blessing. She's at the University of Miami, and she's
awesome.
She's an honor student, so we're very proud of her as well. Yeah.
Okay.
So
then you came to the U.S. You've obviously worked so hard and made sacrifices, and now you are the director of operations,
clinical operations. Yes.
Tell us about that. What is a typical day like for you there?
So right now I'm a mom. I'm a new mom. I have a 9-month-old. I still work as a psychiatric nurse practitioner in a private practice. I do that once or twice a week doing telemedicine only. And then apart from that, I am the director of clinical operations for Diverse Clinical Research. So basically, that is my main job. And what we do there is clinical research trials or clinical trials for new medications, devices, trying to improve and give other options to patients that really need it.
Yeah. Is it for general medicine or for psychiatry?
So we do a little bit of both. So we're multi-specialty. We have different principal investigators. We have a psychiatrist on board, and of course me. I'm one of the sub-investigators for the psychiatry part of the trials. And we've done major depressive disorder. We've done schizophrenia, inpatient. A trial inpatient. So not only do we do outpatient, but we also do trials inpatient for medications that required, monitoring for a longer period of time.
And what's the feedback with the community?
I mean, the community, it's complicated because a lot of patients see clinical trials as, oh no, I don't want to be a guinea pig, right? That's like the first thing that comes to anyone's mind.
Yes.
Yeah. It's like, no, like why would I? But at the same time, in order for us or for science to develop and for us to have different medications, we need to kind of, be open to clinical trials. So I think education in the clinical trials or telling patients and educating them about what it entails to participate in a trial is very important, because I think that's what's going on with the community. Lack of education.
Right.
When it comes to trials. And I mean, the good part is, and it helps them a lot because they do get compensated for their time and travels. So that's something a lot of patients also that participate, low income patients are usually the ones that, are willing to participate more, because it does help them financially as well.
Sure.
But yeah, I think education is the main one.
Yes.
And I mean, something like this, it's like the best
to get the word
out there, and they don't have to go anywhere. They could just go into Spotify and see the podcast and get informed.
Right.
So this is like I said, I'm so blessed and so honored to be here with you, with both of you today here.
Let me ask you this, Sylvie. So we know with COVID, right? Thankfully, there were so many people that did volunteer for these clinical trials, and we learned quickly.
Yes.
We learned about. Yes, thank you. So it's because of these clinical trials that we're able to move forward. Science can move forward.
Yes.
So, tell us maybe one of the most profound things that you have found in your research, maybe when it comes to anxiety or depression, or what kinds of things have you found in your own research?
So the research that we do, it's for specific medications, right? Or at least the ones for the depressive or the psychiatric disorders, right? So in reality, and it's super important for diversifying the data and the patients that participate in these trials, because a lot of medications, they don't do well on certain ethnicities, correct. So that's why diversity is so important. The same thing, like you said, with COVID. I mean, COVID was like, it opened everyone's eyes, and it's, thanks to these patients that were willing to participate in the trials, we were able to know or learn a little bit more about COVID-19. And there's so much still that we don't know, right? And then we need to continue
so many different variants that happen.
So many variants. And then when it comes to major depressive disorder, patients actually do get better with these medications. And I've seen the change when you do certain scales that we utilize for to rate, to see, upon screening, moving forward at different stages, you see the results, and patients are getting better with different medications that are still not in the market, but yet they're receiving treatment, and it's free for them, free of charge. The thing with clinical trials too is that it's blinded. So for instance, a patient might be receiving a placebo, or they might be receiving the actual medication. So that's part of the trial itself, but that's how we know if it works or it doesn't work.
Results, do we present it to the pharmaceutical company or to the FDA to see if anything?
So everything's pretty much blinded for us as a site.
Right.
So for us as a site, we just transmit the data. So vital signs, everything that we have to do in a specific visit, depending on the protocol, and everything is sent over to the sponsor, which is a pharmaceutical company, and then they process all that data, and then they present it to the FDA for it to get approved, or depending on their. But in reality, we don't know anything, or we don't know what other sites are doing, or how they're doing, until that data is already presented to the FDA.
Got it. Okay.
Yeah. It's very interesting. It's not like we know specifically, this patient, is getting the placebo, or it's completely blinded. And that's how they do it for that purpose, for it to be
not to be
biased, or So it's very interesting. It's a very interesting part of, and you could get into it as a nurse. I mean, there are so many career opportunities in clinical research that people are not aware of.
And the ultimate goal is to find something that can be helpful.
That can be helpful, yes. Certain, medications that trigger certain neurotransmitters that maybe, the ones in the market don't, or, it's,
like the off-label use.
Correct, yes. Okay. So it's, and a lot of medications that are already FDA approved, they're trying to look for other, for instance, if it's a medication that's FDA approved for anxiety, seeing if that medication helps a patient with schizophrenia, so different.
Oh, wow.
Yeah, so it's very interesting. There are so many trials and so many options out there.
Speaking, now that you just said anxiety, and I know that we were talking about this earlier, but I was just reading that the Journal for Anxiety states that anxiety has gone up 300% since pre-pandemic times. So do you find that you're seeing a lot of
Yes.
people with anxiety?
Yes, anxiety, depression. It's probably the number one disorder that I see in practice. I would say probably like 95 to 98% of my patients have anxiety. A lot of the times, patients that come in or present themselves with anxiety, they also have depressive symptoms. Most of them, they come in together. The patients, sometimes they don't even know that they're, in a depressive state, just because it doesn't, they don't really know what symptoms to look out for. But yeah, I mean, usually they do come together, and anxiety, it's very, very big. I would say 95 to 98% of the patients that I see or treat, that's the main diagnosis: anxiety and depression.
And what's the main trigger for their anxiety that you can say there's something that is
that's something that when I always ask that question when I'm interviewing my patients, and most of them don't know. They don't have a trigger, and it comes back, I think, with traumas. When you start looking back, because obviously our visits are not, I'm with them for 30 minutes if it's a follow-up, an hour if it's an initial. So there's only so much you could talk about.
Correct.
But when you start, as the sessions progress and I start, seeing them more and more, you start seeing that a lot of it comes from trauma or any kind of traumatic event in their lives. Wow. And that kind of triggers their anxiety and depressive episodes. But yeah, and COVID, it was a big.
The pandemic, like everything got exacerbated.
Yeah,
right
everything,
after.
because being at home, parents that were at home with their kids 24/7, that they weren't used to that.
Right. That was not easy.
Yeah, it wasn't easy for them. Us as nurses, working and kind of going and bringing, or the potential, of bringing the virus back home to your families. I mean, it was just so much. I mean,
because we can, in the healthcare field, you cannot deny service or refuse to care for a patient because
we were all working.
We were all working, correct. We were all working. And for me, I mean, I remember my husband, he works in the hospital. So it was very,
scary.
Very, very scary for us. And then me working at home, I used to do home health. So I used to go to the patients' houses. So it was a little bit different because we didn't have, it was complicated when it came to a lot of things and treating patients at home with COVID. And protecting yourself as well,
And it's good for to reinforce this to our listeners that mental health or psychiatric conditions, there's two different settings that we can see mental disorders. We have the acute setting, like in a hospital or in an institution, and then we have the outpatient setting, like everybody can go because they're dealing with something and they want to talk about it and they don't know where to begin on. Like you mentioned, they have tried all the holistic care, they saying that, but I've done everything right. Why am I still feeling like this?
And that's when it really tells me you have anxiety, because you don't know, you can't pinpoint this was my trigger. And a lot of it happens a lot, and I see it very frequently with patients with panic attacks or panic disorder. A lot of them don't have a specific trigger, and it just, spontaneously, I'm driving and I see it coming and I start feeling this way. And that's just,
scary.
It's very scary.
Especially when, again, because of the education or lack of education in our communities, it's good that we're bringing this out there to talk about.
Yes, because it's very, very important. And,
It is. And I think that, to have this platform where we are able to discuss these things and provide resources for people listening.
Yes.
It's so important because oftentimes, people that do go through panic attacks or have anxiety or major depressive disorder or whatever it is, you sometimes feel alone.
Yes.
And you're not alone. You're not alone. You have all these different resources.
Yes. And it's, you say it and it happens so frequently, because what happens is, even though they have a whole family and they have, they don't want to kind of be a burden on their families. So they don't really express themselves, and they don't talk about their feelings to anyone. So that's why it's so important. Apart, when the patients come to me, I do medication management. So that's pretty much, the big portion of what I do. But psychotherapy, I always tell them I always refer most of my patients to psychotherapy, because the combination of psychotherapy and the medication is a gold standard for any mental health condition. It would really help you, because you would have that free, that free space to communicate with someone that's not going to judge you. It's not going to, and it's kind of, you know, it's really what's going to help you.
And especially here in Miami or in the Latin community,
yes,
you don't talk with someone because they're not going to understand you, or they tell you, okay, se te va a pasar.
Yeah.
And
one of the big things here in the Hispanic community, oh no, I don't see a psychiatrist because I'm not crazy.
Right.
You know?
They associate
And they
that with,
associate, yo no estoy loca. So it's like, that's a big thing. I mean, you talk to your parents, or I talk to my parents, and sometimes they tell me, you know, like, no, it's not, you don't have to be crazy or label yourself as crazy to see a provider. Correct, you know, all of us have some kind of stress in our lives.
We were just saying before you got here, and I'm sorry to interrupt you, but it's interesting that you say this, because we coincidentally we were saying we all have some sort of internal struggle.
Yes.
Every
single person,
has some sort of struggle, some internal struggle that they're dealing with.
Yes, and it's all about how you cope with that struggle.
Yeah,
right.
There's the healthier and the
some patients don't, or some people don't know how to cope with it, or don't know, or maybe, you know, and that's when the mental health conditions begin to, or the symptoms begin to arise.
And then diseases, chronic illness, and that's how it starts.
And the mind is it's so powerful. So powerful.
So powerful.
Yes.
How do you cope dealing with all the patients, or what you see, the worst cases that you see? Do you take that home, or how?
Truthfully, and we were talking about it earlier as well. I thought when I began became a psychiatric nurse practitioner, I really think, because I'm very sentimental, or I'm a very
an empath.
Yeah. Yes, I do. So I really thought I was gonna take it home, and I was gonna be, you know, telling my husband the whole stories about my. And no, I actually don't take it home. I feel that little things for me is just self-care. For instance, self-care, and I'm not the type of person that, you know, my type of self-care is not going to exercise, even though I should. You know, that's usually one of the things that I tell my patients, that, you know, exercise is so important. I don't do it. I should start doing it because it will help me a lot. But something as simple as getting my nails done, that to me is, you know, or getting my hair done, or
look good, feels good, right?
Yeah, or going for a coffee, or, you know, treating myself to a nice cup of coffee, or going out with friends, you know, having girly conversations, and not, you know, kind of getting out from my routine, right? That helps me a lot.
I love that.
And affirmations in the morning. That's like a must for me. You know,
affirmations
in the morning.
We love affirmations.
What is your go-to affirmation? What do you say?
So, everything. I am strong. I am beautiful. I am empowered.
Yes.
I am empowered. And I just, you know, I try to do it for my baby as well. Even though he's only 9 months, I tell him every single morning, you know, I try to make it a routine for him, so he could know that no matter what, you always have to, you know, do your affirmations.
We actually spoke about this with Annie Vasquez, the alchemist, and we gave an example too about a plant, right? Mm-hmm. That when you say nice things to a plant versus saying not nice things to another plant, how that can grow differently. So if you start doing that with baby now, that's awesome.
Yeah, for sure. And also in my mirror, in the morning, like I always kind of, or I have like a quote in my mirror in the morning. So every single, you know, not a quote, but like an affirmation. Like I try to put 2 or 3 affirmations there and change it like once a week.
That's nice.
So when I wake up, sometimes I forget, but I look at it, you know, and I see it there. So, you know, that's something else that helps me a lot too. But yeah, I mean, that's just, for me, self-care is one of, or my little things, you know, it's what makes me happy.
I love it. Sylvie, for people listening right now, I want you to stress something. Why should we do clinical trials? Why? And I just wanted to go back to that for a second. Why? What is the number one reason?
Advancing science. Advancing science, and it's just about finding a cure, for instance, cancer, right? Mm-hmm. Without clinical trials, I mean, we are not able to see what options. There are so many. We're doing a trial on myasthenia gravis. Oh. It's a rare condition, right?
Educate me. What is that? I have no idea.
So myasthenia gravis is an autoimmune disorder, and it affects the patient. You know, it paralyzes certain areas. Mm-hmm. So it's autoimmune.
And there's no cure.
And there's no cure.
Right now.
So we are testing a medication to see if the symptoms improve, because most of these patients live, you know, their lives with generalized weakness, you know, and it's a really debilitating disorder.
Yeah.
So I think education, coming back to education in clinical trials is so important. Like I attended a health fair for myasthenia gravis patients. And these patients, they went there because they were seeking options.
They're desperate. They're
desperate because they don't, the current medications or the current treatments that are out there are not helping them.
Yeah.
So it's all about, you know, advancing science, and that's the most important, and being open, and don't think, oh, I don't want to be a guinea pig, you know?
Yeah.
You're doing it when it comes also, I've seen a difference when patients are already with, for instance, someone with myasthenia gravis, they are more willing to participate because they're very desperate. They're desperate
to find answers.
Right. Yeah. And I've seen that a lot. That was a conversation that I was having yesterday. We have a patient that potentially is going to participate in this trial, and he hasn't even asked, not even once, if he's going to get compensated for this trial, because that's not really what he's doing.
That's not his motivation.
No.
His motivation is to get better, to feel better.
So that's when you really see, you know, these rare diseases. And major depressive disorders, and you know, all these psychiatric illnesses as well. I mean, they want to get better, and they already come to us as providers seeking to get better, and you know, desperate.
Yeah.
And
what is scary about autoimmune diseases is that they're all correlated somehow. Like I have celiac disease. I know it's autoimmune. Now I'm prone to developing other
yes,
autoimmune diseases. Yeah. So it is scary.
It's scary, but yeah, I think yesterday that patient that called, and he didn't, you know, and he's coming all the way from Orlando. Aww. So it's a patient that we're arranging so many things, you know, like so many little puzzle pieces need to come together in order for him to come in and get started on the trial, and he hasn't even asked about compensation.
Well, I hope that the trial does something.
I really hope so too.
Very good.
Yes, I really hope so too.
Sylvia, you're doing amazing work.
Oh, thank you so much. I do it with all my heart. I really do. I got into nursing, not really knowing what a nurse would do. And
there's so many things that we can do.
Yeah, so much, and helping others. It's, you know, that's the reason why I do what I do, to help others, and you know, it's really, I think it's rewarding.
Yeah,
very much.
And also, I think you mentioned something that really also fueled you into going to the mental health, and you spoke about your grandma.
Yes, my grandmother. So one of the things with why I went into mental health, my grandmother, she has dementia. She pretty much raised me alongside my parents when we came to this country. And you see such a huge change in her as we age. I mean, we work with the geriatric community, and we see it all the time. Yes. We see a patient that maybe 10 years ago wasn't anxious or wasn't depressed, and as we age, we tend to develop all these, you know, psychiatric conditions. And my grandmother, she became with the dementia, agitation, super agitated, and not only was she being affected by, you know, by the condition, the caregivers, the family. It changes completely.
Because with us, we do it every day. Yeah. It's not as difficult to deal with our elderly population, but the family. They're so affected.
They're incredibly affected, and you know, it's interesting that you say that. I was also just reading that 65% of caregivers deteriorate faster than the actual person that has the cognitive impairment, or you know, we see where, you know, in our line of work, we see, you know, people that are present with frontal temporal lobe dementia and vascular dementia and Lewy body and all kinds of, and like you said, you know, you see this person deteriorate in front of you, and
so
it just
quickly
affects the entire family.
Yeah.
So for you to see your grandmother like that was your drive.
That was my drive. I wanted to, you know, be able to help not only the patient itself, you know, because the patient obviously needs help and needs care and needs treatment, but also the family members, you know. Because like you said, the family members get affected, or they deteriorate a lot more or faster than the patient.
And a lot of time they're in denial. They cannot understand what's going on, the changes are happening, and they struggle to accept their reality.
Yeah, and it's very sad. It's very sad because the family members, you know, most of them present again with anxiety and depression because they're feeling, or they see this individual, you know.
They have so much guilt.
Yeah.
It's that guilt that they have inside, right? Like to see their
loved ones deteriorate. Yeah. It's very sad.
Sylvie, let me ask you, if you could give a tip, maybe to someone that is dealing with anxiety right now, what would be your go-to? Like, what would you say to them right now?
So for me, seek help. Or, you know, maybe if it's not going to see a provider, at least talk to someone about it. Talking to someone, it's going to help you so much. I have patients that sometimes they come in and I don't give them medications just because they don't meet certain criteria for medications at that point. And they tell me, just talking to you, I mean, I feel so much better already. So I think it's something about talking.
Therapy.
Talk therapy is so important. If you don't have, some people, you know, also financial means, right? If they have insurance, they don't have insurance. But find someone that you feel comfortable with. If you don't have the means to actually, you know, see a provider, but find someone that you feel comfortable with, and you're able to do a little bit of talk therapy and kind of
we all need it.
We all need it.
We all need talk therapy. We all need someone to talk to. We all want to feel heard. We all want to feel listened to
and relatable.
Yes.
Yeah.
Thank you, Silvia, so much for being here and sharing your experience and educate us and educate the listeners that we're having so they can have a better understanding about psychiatry, about mental health, and about clinical research. So thank you so much for being here.
Of course, it's been a great pleasure.
So if you guys want to reach Silvia directly, you can by going onto her Instagram, which is @diverse_clinical_research. Again, to reach Silvia on her Instagram, it's @diverse_clinical_research. And as for us, we ask you please to continue to engage with us in social media, provide us your feedback, talk to us, tell us the different topics that you want to hear. And you can do that by going on to our Instagram, which is Breaking Barriers, the podcast. Again, it's Breaking Barriers, the podcast. And to listen to these podcasts, you can go on Apple Podcasts, Spotify, and you can see us on YouTube. So until next time,
Bye.
Bye. Thank you.